All right. Well, good morning, or good afternoon. I want to thank Orlando Health for having us back, and thanks for all the great work that they've done here, and been a great source of information and advice for us throughout the whole course of this. So I want to thank them for doing this. I'm going to just give a quick overview. Halsey's going to have an announcement. Secretary Bashir is on the DBPR front, and then we're going to talk to the doctors about some of the stuff. But first, Dr. Rawls, did you want to just say anything on opening?
Sure. So first, Governor, thank you for coming to see us again, and we're certainly very appreciative of the attention you've given to Central Florida through this event. We've got some good information to share. Looking forward to informing everybody about where we are and where we will be as we move through this. And again, thank you for spending that time with us.
Absolutely, and thanks so much for your help. So we're closing on 1.7 million tests. Been doing a lot. Obviously, that's escalated a lot in the last month. We're going to continue to doing that. We finished if you look at the state of Florida and nationwide, I think pretty much almost every state at least reports it the way Florida does. The majority of the fatalities associated with COVID-19 have been folks who were residents of long-term care facilities. The median age, according to CDC nationally, of COVID-related fatalities, I think is 80 or 81. In Florida, I think it's a little bit higher, and we've had more COVID-related fatalities over the age of 90 than we've had under the age of 65 throughout the course. And so the long-term care facilities has been one of the top priorities. We've now gone through and either tested or at least offered a test to every resident of our long-term care facilities. We have over 4,000 facilities in the state of Florida, and we have tested the staff, or at least offered a test to the staff. And as of this point, almost 80% of all those 4,000 plus facilities have not had a single COVID case, either resident or staff. So we believe that that's an important thing to keep going. We're going to be launching on Friday our testing program to test all staff at long-term care facilities once every 2 weeks. And we believe by continuing to do that, trying to identify particularly the asymptomatic spread. When the workers come in, they're required, and we've provided PPE, they get temperature checks, they get screened about any type of contacts, which is important. But you have a virus that a lot of times is either mild or has zero symptoms for a lot of people, particularly people in the age groups that may be working at some of these facilities. So we think it's important to continue to do the PCR testing on a regular basis, and so we are going to be doing that. Now, one of the things we've been seeing, important to protect the vulnerable because that's where most of the clinical consequences are, and that's been our focus really from the beginning of this, both in terms of the long-term care facilities, but then also just advising our senior citizens not in those long-term care facilities to make sure they're avoiding crowds and maintaining appropriate social distance. What we've seen, particularly over the last week, is a real explosion in new cases amongst our younger demographics. And so when we started this in March, the median age of people who tested positive was, I think, 65. As the testing ramped up, that went into the 50s, but it was pretty much in the 50s for most of the time, and then just recently has really plunged so that last week the median age was 35 years old. So half of these positive tests are in that 34 and under age group, and the bulk of the tests that we're seeing are really the 25 to 34-year-olds. They represent the largest share of all positive tests by pretty decent margin for anyone throughout the course of the pandemic, and they weren't even really being tested very much in March, and so that's a big change. And then if you look here in Central Florida, the median age of new cases for yesterday that was reported today is even younger, 32 in Orange, 32 in Seminole. Orange has even been younger over the last week. It's been, I think, 29, 30. Seminole, I think, has been as low as 27 or 26. So you see how this is kind of skewing. Now, the good thing about that is if you look at any data set, the folks in that age group, unless they have a real serious underlying condition, do not suffer the same types of clinical consequences, whether hospitalization or certainly COVID-related fatalities, that people in the older group would do. And in fact, even though we had a lot of new tests at higher levels last week. We actually had fewer positive tests with our long-term care facilities than we had. So that the cases there actually went down, which was a good sign. But what we're seeing is part of that is some of the contact tracing and some of the discrete outbreaks we've seen around the state, but really most of it is community transmission, particularly amongst the 20 and 30-year-old group. And I think part of that is just natural. You kind of go and, you want to be doing things. You want to be more out and about. I think the folks who are a little older and would be more vulnerable have been a little bit more careful. So you're just seeing, I think, more contact, and that's why you're seeing this. I'm going to talk in a minute about what we're kind of going to do going forward. But clearly, you're seeing this. This is real. Now, they are testing more than they were for sure, but they're also testing positive at a higher rate than they were before, and so that would tell you, there's probably it had been an escalation in transmission over the last 7 to 10 days. So that's probably the number one thing that we're looking at right now, and obviously increasing amount of the new positive cases. So the message is, just stick with the basic program that that we've advised really from the beginning, but certainly since the beginning of May when we went into phase 1. It's still important to maintain the appropriate physical distance. It's very important to exercise good hygiene, wash your hands, do things like that. It makes a difference. And then it's also important, which we advised at the beginning of May and reiterated recently with the Surgeon General, when you can't socially distance and keep that 6 feet, wearing the face mask can help reduce transmission. Very important. And also, if you're in these face-to-face businesses, it's important that the employees are wearing the face mask. And by and large in Florida, I think I've seen that at the businesses. I think that they've really done a good job with this. Obviously, there's some need to improvement. Now, our recovery plan, Dade, Broward, and Palm Beach, where we're still having the most problems, particularly in Dade and Broward, they've been on a separate schedule this whole time, much slower. We've had the rest of the 64 counties went into phase 1 at the beginning of May, and obviously there were restrictions. Businesses would open, but they would have to abide by certain social distancing guidelines. And I think by and large they did a really good job, whether it was the restaurants, whether it was some of the retail. Obviously the theme parks here have done a lot. And so that's all very good. And sure enough, throughout all of May, very steady as she goes. Very manageable caseload. Obviously, people come and go from the hospitals. There were some nursing home outbreaks that we had to deal with, but the positivity rate was low, and things went well. As we got in that's May and early June. Then, as you get into the second week of June, you start to see some more cases pop up, and then by the third week of June, you start to see more widespread transmission. So what we want to do is just reiterate a couple things. With the restaurants, most of them have done well, but you have half capacity limitations and indoors, and those tables got to be spaced for the 6 feet. That is the way that you can do that in a low-risk way. And then recently now with pubs to be able to allow they're treated the same as a restaurant. You go in, seated service only. You have a 50% occupancy limit with the appropriate social distancing. And that is something that is low risk. And our view is, obviously, we want businesses to be able to operate if they can do it in a low-risk environment. Now, there have been instances recently where that was not the case. The Secretary suspended a liquor license from a place here in Central Florida, that was having really, big parties, which again are just not following the guidelines. And I'm going to kick it over to him in a minute. But basically, what I told him is, this is very easy to understand. We're in a step-by-step process as we've moved forward here. The guidelines are in place for a reason. You're not doing it just to do it. The reason that they're doing it is because you want to have environments that are not going to be huge risks for transmission. And if you don't follow the guidelines and you pack huge numbers of people indoors that are very close, you're creating an environment that you're going to see more spread. And I think we've seen that with some of the younger. And obviously, I'm not harping only on like a restaurant. because most of them have done a great job, and obviously the social contact that's going on is far beyond just that. I mean, people are hanging out at people's houses, they're doing all kinds of stuff, they're very active. But it is important to follow the guidelines, and if people see a pub or a restaurant, if they're operating at 55%, okay, give them a warning, tell them, hey, 50. But if you go in and it's just like mayhem, like Dance Party USA, and it's packed to the rafters, that's just cut and dry, and that's not just an innocent mistake. And so I told him, no tolerance for that. Just suspend the license, and then we'll move on. And then people will, I hopefully, get the message that these guidelines are in place for a reason. So we want to make sure people are continuing to follow the basic instructions, whether it's masks, social distancing, washing your hands. That stuff will help reduce the spread. And when we went through this in March and took different actions, March and April, the goal was to slow the spread so that we could flatten the curve and have the hospital capacity to deal with the effects of the virus. That obviously worked. We had in April, we were projected by some of these models to have 460,000 people hospitalized. We had about 2,200 at the date that they picked for that, and the hospitals were never threatened to go overboard. We were good. But we also knew that when you flatten the curve, you will have the infections spread out longer. If you don't flatten the curve, it goes up, and then it kind of crashes down. So flatter curve means you're still going to have cases. We said that from the beginning, that the virus isn't gone. We want to be able to get people back to work in a way that is going to mitigate further spread. And so these guidelines are very, very important. And so that's what we want to be doing. And I want to send it over to Secretary Beshears about kind of the message for folks to, particularly the businesses, to make sure that that they're following the guidelines.
Thank you, Governor. Good afternoon, everyone. Thank you for allowing me to be here with you, Governor. I'll be very brief. After discovering that there were some flagrant violations with the Knights Pub, based on contact tracing, it was very easy. 13 employees. We had 28 patrons that tested positive, and due to their advertisements, we pulled their liquor license last night. I've contacted several sheriffs. We're going to continue to do that throughout the state. This is simple, like the governor said. Those that are in flagrant violation, we have ABT officers that are going to be out from now on from 5 p.m. to 1 a.m. checking on these bars and restaurants that are in violation of this, and we are going to issue a warning to those that are trying to do the best they can, but that's not what we're talking about. But like I said, those that were flagrant, we'll be suspending their license. That starts, we started this actually last week. We're going to continue this until we get this right.
Thanks, Secretary. Look, it's just not worth it to try to just go totally beyond these guidelines. I mean, they're in place for a reason. They were done basic on consultation with folks in the medical business communities, the community as a whole, so that we would be able to have low-risk environments operating. And if you're not willing to do that, then you're going to get a visit here from I guess he'll be kind of the grim reaper in terms of business licenses, because there's not going to be any tolerance for it. And I will say most of the folks have done a great job. Most of the citizens who've gone in have done a great job in exercising the appropriate restraint. So we really, really appreciate that. I wanted to bring in the doctors, and I really appreciate both of them for being here. We have Dr. Sunil Desai and Dr. George Rawls have been helping us understand what's going on from the very beginning. But I think it's interesting to discuss some of the trends that they've seen in terms of patient acuity, treatments, how they're handling elective surgeries, and I think that folks would really, really appreciate it. So why don't you both weigh in, maybe start with Dr. Desai. You guys have told me pretty much every hospital that I've discussed it with has said that there is a difference in the average patient's acuity who's coming in with COVID-19 between the patients you were seeing in March and April and some of the patients you're seeing now. Is that the case, and why do you think it's the case?
Thank you. I'm glad to answer that. First, Governor DeSantis, Secretary Beshear, thank you for having myself and Dr. Rawls here this afternoon. I'm glad to help in any way possible. First of all, you're right. We are seeing a different population right now. The population that is skewing a little younger, as you demonstrated there earlier. The age 30 to 55 it would be the age group. The acuity is less. A lot less folks using or requiring mechanical ventilation or the severe presentations of COVID. We're not seeing as much as that. There are a lot of reasons for that. I would say one of the biggest things is I think we're beginning to understand how to treat this disease, recognize it in a better fashion, and modifying as we go the various treatment regimens. One of the things I would like to stress, particularly to the media in general, is to never in my career have I seen so much science come out, and I use that term loosely. And when I say science, there's a rush to be the first to publish, and I totally appreciate my academic colleagues who do this, to publish data on new breakthrough and novel therapies. But we really have to vet those things well and first do no harm. Not all of the things you hear that come out first, particularly in the lay publications, are actually safe to use. So I just make that as a general case across the board. The disease, when it's at its severest, gives the acute respiratory distress syndrome, the adult respiratory distress syndrome. Acronym is given to that clinical picture. It's been around for 50 years. We have a good handle on how to handle that and what works. Thankfully, we're not seeing as many of those right now.
What percentage, so in March and April, what percentage of the COVID hospitalized patients required ventilation then, and then what percentages are requiring it now?
Our peak, our first peak, let's just call it, was in April. We had about 54 patients or so. Almost 50% were requiring mechanical ventilation. As of today in the health system, we've got, and Dr. Rawls can correct me, we've got about 108 patients across the system. 3 are on ventilators. So a significant drop in acuity, which is, of course, welcomed by all. Yeah.
And just one thing in terms of the COVID patients, and because I think Dr. Rawls, can you talk about in March and April we didn't have the elective procedures going on, and it's starting at the beginning of March, or excuse me, beginning of May, started to allow elective procedures. Obviously, people started coming in. When someone comes in, not only just for elective procedure, but even emergent, are you testing all those people for COVID-19?
Yes, sir. Yeah, so one of the big differences now is that anybody who comes into our health system for any type of a procedure, to include labor and delivery, if it's a trauma patient, anybody who's going to require a procedure gets tested for COVID-19. So our testing is much, much broader than it was during the first wave. And we see a significant number of those patients test positive. So there was sort of a snapshot as an example last week where 20% of our COVID positive patients in the hospital were in the hospital for things completely unrelated to COVID. Could have been a broken leg, could have been a gunshot wound, those sort of things. So that does contribute to our numbers some. And in addition to that, we have some therapies in place. Remdesivir is a good example, the one medication you may have heard about that we're using in the majority of our patients that are being admitted. And that medication actually does lengthen your time in the hospital. So there's an impact there to the numbers that sort of accumulate as far as our inpatient count. But very, very different right now than it was during the first wave in terms of how we're testing and what that inpatient population looks like. Not to say that the testing isn't useful. It's actually very, very useful for us because that's one of the best ways that we can mitigate spread within a hospital and maintain the safe environment we're trying to maintain here.
Are you guys doing any antibody testing?
Yeah, so antibody testing is an interesting sort of conundrum. What do you actually do with antibody testing? We do have the ability to do antibody testing in our system. We use it in very, very selected scenarios because if you look at any of the algorithms for antibody testing, whether you have antibodies or not, the decision about whether you can be contagious is based on the nasal swab. So we don't usually antibody test people to tell them anything about infectivity. It's really more information, if you will. So we are testing some people, both nasal swab and antibody testing on the same day and seeing some interesting results there. But it's available, not heavily being utilized right now for the day-to-day decision-making in a hospital.
If I could just add with the antibody testing, one of the things we have to keep in mind is the implication is that someone has had COVID, 1, 2, that they're immune. Right now, the latter is not confirmed. We don't know to what level of immunity someone has, how long it lasts. So there is a danger of giving a false sense of, hey, I've got an antibody, I'm immune, I can go out and do whatever I want to, or for that matter, that you're not infected. Those are two different, you're not infectious, or you won't be able to spread it. So those are two different things altogether. And the science is still trying to sort that out.
So in terms of the more recent testing, I think you guys have, when you've been testing, and you're typically, I think the number of people that would test positive would be what, like 2, 3, 4% range?
It was right around 2% when we were in the first wave.
And then now, I think, what, in the last 7 days, mostly you've seen that increase. So what do you attribute that to? I know, like, some people, have talked about, well, with the businesses opening and stuff. I mean, do you think it's because businesses are open? Do you think it's more social interaction?
I would say what we've seen in our percent positive rate, so the number of tests every run, what percentage of those are positive, looks exactly like what we're seeing in the community. I mean, it's the exact same trend that you see in the state numbers for the county as well as the state. And it really has to do with the fact that there's been more widespread community transmission, as we know, we've discussed, and that's translated into the patients that we're seeing. So we had pretty consistently been seeing percent positive rates that were just above 2% for several weeks through first wave. Even when we got into this sort of early part of the reopenings, we didn't really see a big jump there. It's really been in the last 10 days, and most concentrated in the last 7 days, where we've seen that percent positive jump into the double digits now, sort of 10, 11, 12%. Again, very similar to what we've seen in the community numbers.
I think some of there's a lot of reasons potentially for that. Some speculation on my part, but if you see what's happening, it's hard to change behavior. It's hard to get folks to do what we need to do. But I think on the slide that you showed earlier, hand hygiene, social distancing, and wearing your mask, still the basics, they're shown to work, and that's what we need to be doing. As we, human nature, it's hard to do. So, but that I would attribute it, our rising numbers and greater testing is why we're seeing that.
But do you think it's rooted more in the fact that more businesses are open, or do you think it's more of like on the social side?
It's on the social side. In fact, one thing about businesses opening, they've actually, and we're working with businesses in Central Florida, Orlando Health is. We actually have a whole group doing just that, helping them open safely, which is what we need to do. However, the businesses are using, most businesses are using evidence-based folks who are rooted in evidence-based medicine to basically implement these initiatives, and there's someone to answer to. So those employees actually, when they're at work, behave pretty well. Okay, it is the social where we're with friends and family, and all of a sudden you're at a party and the guard goes down, as opposed to in a business. So I'm again, anecdotally, it's less likely pure offices opening. It's mostly social.
Governor, if I could just add, I think that's just a really, really important point to hit that. I think the community needs to think about where the risk really is, and it's where we let our guard down. If you're going into a business that's got great practices in place, we know there were some, as we heard from Secretary Beshear, that aren't doing everything they should be doing. For the ones that are doing the right thing, you can maintain a safe environment and open a business. Where we're letting our guard down are the pool parties, or the social gatherings, or the places where we are not thinking about transmission, where we're not wearing our masks, where we're not thinking about social distancing. So it is completely compatible to have business reopenings and maintain a safe community. We just got to be really, really thoughtful about the way we interact in the rest of the times that we are around each other.
Great. Well, I really just commend here Orlando Health, but then Orange County generally. I think if you look around the state, they have probably one of the lowest hospitalization rates per case. And obviously, as they said, now with elective procedures, some of those are hospitalized with COVID, not necessarily hospitalized because of it, but still, that's happening all over, so it's not like it would only affect them. And if you look at their nursing home outbreaks, very few cases in nursing homes here in Orange County. That's made a huge, huge difference, the fact that they have a lower per capita fatality rate compared to some of the other places. And I would say if you look around the state, the counties that tended to have higher per capita fatality rates, it's almost always linked to having more cases in long-term care facilities. And so I think that they've done a good job. And then also here, they do a good job contact tracing so that when you have somebody, you're identifying outbreaks. And they've done a number of different outbreaks that they've been able to identify here. Part of, I think, the positivity, I think, is because I think you are seeing more contact community transmission. I do think part of it, it's probably a smaller part, but I do think it's a part is when you're doing effective contact tracing, if I test 10 people off the street, you know, the positivity is going to be one thing. But if I test 10 people who I've contact traced that have been in close sustained contact with someone that just tested positive, well, guess what? They're going to be a little bit more likely to have cases of that age, of that cohort. And I think you're seeing some of that as well. But that's good work. That's what you want to be doing to be able to identify an outbreak and then contain it. In March, it was almost like you're flying blind because there was a limited amount of testing capacity. That testing capacity was really limited to the people who were symptomatic, and even beyond that, the people who were 65 and plus, 60 plus. If you were 20-year-old and healthy in March, you know, you weren't going to come here and get a test. That just wasn't the way it went. If you were symptomatic and younger, you still may not have gotten it. Now we're in a situation where if you identify a potential cluster, you don't have to tell them to just, I mean, you can go test people, and we have that capacity to do it. So that really does make a difference. So, you know, we've seen this trend over the last week or so. That'll be a part of kind of helping to turn it back. I'm less concerned about the number of cases. I mean, obviously you're going to have cases. For every case, there's probably 10 to 20 times as many infections in terms of the infection fatality rate, the way that's calculated. So that's just the reality of the situation. But I do think that infrastructure is very, very important to have in terms of the testing. And then also just to reiterate what some of the physicians said, you do have things like remdesivir now. We worked hard to get that down here with HHS, working with, I think, Gilead was the company. That has been, that's gotten high marks throughout the state in terms of giving it to patients particularly early. And then as well, the convalescent plasma. We continue to ask people, if you do have the antibodies, consider going in to give blood, make a blood donation, because they can use that to treat patients going forward. So I want to thank them for what they're doing. Oh, a couple things just about like hospital capacity. We, throughout the course of so before the pandemic began, I think Florida's hospitals are running about 88, 89%. The census probably 88, 89%. Is that a pretty normal way a hospital would run?
Generally speaking, that would be normal.
Yeah.
Okay. Volumes took a big hit in the last 6 weeks. And suffice it to say, we've seen that pent-up demand come through with elective surgeries and folks, you know, hopefully not delaying their care and you know, reiterating that we are safe, we're doing things in a thoughtful manner, so we are seeing those volumes go back up. One of the things I would want to reassure the entire Central Florida community is, particularly for Orlando Health, not only do we have capacity to take care of all of our community and patients, not only just COVID patients, but we have not even tapped into the surge capability should we ever need that, and we do have that, and that's a 30 to 40% bed capacity above our base. So.
But I mean, so when you didn't have the elective surgeries, a lot of the hospitals were running 60% full, which is totally abnormal, makes it more difficult. Then we put the elective surgeries in, people started coming back for that. So the increase in the census from May 1st until now has primarily been driven not necessarily by COVID, but by the elective procedures and then people going in to get more comfortable getting care again, right?
Yeah, probably one of the most important things to point out is the elective procedures are one thing, but there were a lot of medical needs that were put off, as we had talked about the last time we were together. That has thankfully come back. People have come back to the hospital, they've come back to the primary care doctors, they've come back to the ERs with those really serious conditions that we saw them put off, and we saw some of the tragic outcomes last time. So thankfully they're back, and that means volumes are up. But when you're looking at numbers, that 85% capacity number, you know, again, had you looked at that number a year ago, it would have looked the same. That is pretty much the way we look most of the time. And we have a great capacity to surge in different directions, whether it's ICU or regular med-surge beds as needed, depending what the volumes look like.
And I think statewide, I mean, we've been between 25 and 30% for the last month, ever since the elective procedures went on, of available beds. I mean, so that's that's more than what you would normally have in the high season, and obviously have the ability to be able to do different things. Because sometimes you see saying, oh, there's only 24% of ICU beds in Duval County, and it's like, okay, well, that's usually how they run it. It's not like that's because there's COVID patients overflowing the ICU. So we just wanted to make that clear. But I want to thank them for all they're doing. I want to thank Halsey. Hopefully he won't need to be doing a lot of suspensions, but I reckon he's probably going to need to do a few more to really send the message. And so we'll all be waiting for that. And with that, I'm happy to answer any questions.
Well, thank you. The phase 2 actually wasn't opened up till June 5th, which was that Friday. And so I don't know about the June 3rd, June 4th complaints.
They were doing that. That wasn't authorized by any of our. Okay.
Well, when we received the complaint, I mean, we acted on it. That's it. So we've only received 106 complaints throughout the state since June 5th, since phase 2 started. And every one of those we've acted on. And I want to make a point about that. The message that we passed down to our ABT agents were, everyone remembers when they were 25. I was 25 and I was 30. To remember that these people everyone's been locked at home. They want to get out. They want to just get some fresh air and stretch their wings a little bit. So to remember that everyone was going to do the best they could, these restaurants and these bars, to allow people back in and try and maintain the governor's orders. There were going to be a few bad apples. We recognized that. And we wanted to warn them originally and go back. Everyone that we visited and gave them a warning to, we went back, they complied. So we never got the complaint on them. That was through our original portal. We never received a phone call. As soon as I knew about it, we've acted on it.
Governor, I have a question when it comes to Orange County Mayor last week putting in a mask mandate here. He also mentioned that he had sent you a copy of his executive order and had suggested we have one statewide. You know, the city of Tampa has done this as well. Why haven't we seen a statewide mask mandate?
Well, we recommended, advised from the beginning of May about the mask. This isn't anything new for us. We advised that when we went to the step-by-step plan. And my view, a couple things. One, I think you catch more flies with honey than vinegar. I think that you want people to, when some people get ordered, sometimes they don't do. That's why we did that in May. We thought that would be a better way to go about it. But then also just you're seeing outbreaks in metro areas. You're not necessarily seeing them the same way in other parts of the state. And so when you attach criminal penalties for something, you got to enforce it. And the question is, in some of the parts of Florida, is that really a good use of resources? So I've encouraged the locals to fashion those policies that fit their communities, and I think that they've done that. And some state governors have preempted any of that type of activity from the locals, and they wanted to do it all. My view is we got a big, diverse state. The outbreak is not uniform. I mean, even now that you see more cases in Orlando than we did, March, April, May, the demographic in terms of the age is different than what we're seeing in like Dade County. And so how you approach that, I think, should be that. But I think that the folks are now, look, this was, if you go back, I mean, obviously March, it was like a big deal. The coronavirus came, everyone was on edge. We get into April, and as we started going through April, people started to realize Florida was going to do okay. We weren't going to have overrun hospitals, everything. So as we're going, get into the May, the reopen, and people are like, okay, I think people are a little ginger. They were careful, and you go out, businesses opening, kind of get back. Cases were very low still, very steady as she goes. Not a lot of fanfare. Coronavirus then, as we got into the end of May and June, kind of falls out of the news a little bit. Obviously, we had the big protests. We had some other stuff going on in the country. And I think a lot of folks, particularly the younger folks, just kind of thought that, it was behind us. And so I think some of the guard was let down. Now, some of these businesses, that's not just letting your guard down. I mean, I think they know what they're doing. But I think that's just kind of been like a natural thing. So now that this is something that is more back on the front burner, now that you have local officials involved in doing some of this thing, I think the message is being sent. And I do think people are going to respond positively to it. And I get it. I mean, there was a lot of other stuff going on. People weren't talking about it. You didn't see a lot of an indication. Most people probably at the beginning of June don't even know anyone who had ever been infected. And that's starting to change, particularly in the younger demographic. So I think folks understand. I think they understand we've got to get this done in a good way. And the good thing about it is little steps are what makes the big difference. You do not, some of the things that have been done throughout this in different parts of the world or country really weren't that effective. The things that are the most effective are doing the basic hygiene, practicing the basic social distancing. If you can't social distance, having the mask to cut down on transmission. Those are all very easy things to do that will make a huge, huge difference. Yes, sir.
The director of the Orange County Health Department told us that the health department has never checked on any travelers who are supposed to be self-quarantining who are not showing symptoms. In fact, Osceola County said the same things. Has there ever really been enforcement of travelers who are supposed to be self-quarantining, and if so, by whom? We can't get an answer.
The State Department of Health, I know, has been involved. The National Guard has been involved. I mean, we've screened, tens of thousands of people, and I know that there have been people who have been followed up on. Of course, as you know, a lot of the travel's now been shut down from Brazil, which was kind of our number one worry as we got into March or May, and they started to have their outbreak. So that was our concern. We were trying to figure out what to do with it. I asked the president to suspend that travel, and he did, and I think that was the right thing to do.
Was anyone checked on in Orange County? We can't tell them.
I'd have to look that up. I mean, I don't want to tell you that they weren't, or I don't want to tell you that they were. But I know, obviously, we wanted to work on stopping the spread. And if you remember, when we did that with the New York travelers, that was in March, and people said, "Oh, this is crazy." But then it came out that most of the infections throughout the country were coming out of New York, and particularly in southern Florida. So we did that. It was appropriate at the time. Obviously, now it's a much different issue. I'm not as concerned about the travelers there as we were in March or April. No. The hospital numbers are reported. Obviously, the health has the cumulative hospitalization. So I think what the issue was some of the hospitals had told us that they were just using their ICU wing as their COVID wing. So that would be reported as if there were 10 beds, you had 8 patients, 8 ICU patients, when in fact you didn't have 8 patients that had ICU level acuity. So I think the Surgeon General just wanted to know, okay, if you're doing that, how many are actually there or not? Because, you can kind of see if, and I think what's happened, you've seen a lot more cases, not only here, but throughout the country in many parts, but you've not seen an increase in the same acuity levels. In fact, nationally, I think the U.S. has had pretty much flat case. The cases have not gone down nationally, but the acuity definitely has. I mean, if you look at the daily fatalities, the chance of being hospitalized if you test positive is a lot lower. So it's just a sense of trying to get at this acuity question. The people that are going in, what percentage are going to need ICU, what percentage are going to need ventilators, and fortunately, far fewer patients need ventilators than what we thought would happen at the beginning, but certainly many more than what was going on in March and April in terms of the percentage of patients. And so, look, at the end of the day, I think it's an interesting, just having lived through this now for months and months, a case today is not the same as a case on like March 30th, because a case on March 30th was almost always somebody who was symptomatic, usually somebody who was at least 50 plus, but many times 65 plus. So that's a patient where the chance of clinical consequences is much higher. Now, because you have basically wide open testing criteria, you're identifying people who may have been exposed but who do not have symptoms. Many people don't know that they're carrying this, and so you're identifying way more asymptomatic. And so the reason why the percentage of cases that are hospitalized has dropped across the country is because you're finding more infections than you would have been able to do then. And I think the same thing with hospitalization. If you were hospitalized at the end of March, as the doctor said, you're probably going to be more acute than the average hospitalization now, which is obviously very, very important. But then we didn't have the thing where you would come into the hospital for something like an elective procedure, get tested, and then have to go to the COVID wing. That just wasn't happening. In fact, we had our baby at the end of March, and all the, there was no visitors, all that stuff. But, my wife didn't get tested for coronavirus before she gave birth because there just weren't enough tests to go around. So that just wasn't what you were doing. So all of this now, from the testing, the meaning of a case, hospitalization percentages, all that, it's in a much different environment and with a lot of different kind of underlying factors compared to what was going on in March and April. And I think that part of that is because obviously the virus has worked through certain parts of the country and the state. And then obviously, we've worked hard to kind of shift it away from the most vulnerable in the long-term care facilities. Perhaps that's why, you're seeing a little bit younger population. Of course, look, if you're 45, you're going to have a better chance of surviving this thing, even if you end up in the ICU, than somebody who's 85. I mean, I think just the statistics on that are very clear. Yes, sir. Aren't you amazed at how much money we've spent and we've paid out? Last time you asked me that in this room, we hadn't paid out very much. I think, what are we at now? We're probably, definitely, $6, $7, $8 billion even. And we actually, if you compare I'll let you ask your question.
My question being, and although not as bad as it was, we are still hearing from folks who are having a tough time reaching a human being by phone. I know the state contracted out to a couple of these private call centers. I know one of them has answered less than half of the calls that have gone into it. In hindsight, do you feel the state's done enough to actually put bodies on telephones? Anything you would have done different, or your thoughts?
So if you look at the number of individual claims that have been paid, so obviously the total number is one thing, but there have been people that have obviously been paid now for 6-8 weeks. But if you look at the number of individuals who've been paid and then compare that to the jobs lost in March and April, there's more people that have been paid than show up in those numbers. And part of that is because we do with the federal support for the gig workers, some of the independent contractors. But if you look at the jobs that Florida lost as a result of the coronavirus, and you total that up on the statistics, we've paid out more individual claims. I think it's because of that. So with 1.4 million or wherever we are, I didn't look this morning, but we're really a lot. That is just a lot of territory to cover. I will say this. Those folks at DEO, they have personally called and brought people through the process. When different media folks have said, I have 10 names of people that have complained to us, we've taken the names, given it to the agency, and they've gone through and really vetted it. Oh, the numbers today. Okay, so we have 1.526 new unique claimants, 1.5 million unique claimants is where we're up to now. And then we've done $7.23 million. And so I think one of the issues that was just the sheer volume and how you do that, and it was not easy. But I think that they've worked really hard on it. And we've tried to, when we've heard different anecdotes, tried to reach out and say, look, and we have gotten lists, quite frankly, from some folks that probably weren't vetted, because when we looked at the list, some of them had been paid, some of them didn't have a Social Security or whatnot. But I'm just glad that we've been able to pay out an awful lot of money. Obviously, we're going to keep doing that as long as folks are unemployed and eligible. I hope we're going to continue to put people back to work. I think we hit about 200,000 jobs in May. Like to see more of that in June, and that'll be a really, really good thing. All right. Well, thanks, everybody. Appreciate it. Chat a bit out here.